The best way to create a legacy is through a book. That is why the leader in integral beauty, CEO and founder of Global Integral Beauty, Idalis Bailey, has designed the book Global Experts in Integral Beauty with the purpose of connecting professionals worldwide who inspire and transform the community of health, wellness, and aesthetic professionals. Through this bestseller book, you can reach millions of people, increase your brand's credibility and visibility. Position yourself as a global expert in holistic beauty by sharing your story and career path in your own chapter of the book Global Holistic Beauty, Second Edition.
All right.
Mhm.
So I'm going to be talking primarily about, or all about really, facial ultrasound. This is an important technology for making sure that we do injectable treatments safely. And I hope to make that case in this talk. So how did this all sort of come about? Why did I form this opinion? Like many things, it all started with a story, really, an experience. And this began in August of 2021. I was working in the emergency department at this time. And I had a 45-year-old woman who came to the emergency department, and her complaint was around that she had some derma filler placed 4 days ago, and it was put in her cheek. It was pretty vague, the information. I didn't even really know what type of filler was placed. She couldn't really tell me. But she was developing pain, some numbness and paresthesias over the area where she had the filler placed, and then a worsening rash. Initially, she described it as red. Now she was developing some pustules over the area, and it looked much like this.
Wow.
So when we see this, right, does anyone here do injectables? Like, maybe hand to the screen if you
We are
have any
doing here
background.
we are located in New York, or we are doing, that's why it's a surprise for me. I never saw that.
Got it, right? So this is the stuff that, if you do injectables, this is the stuff that keeps you awake at night, right? This is the horrible, dreaded complication of a vascular occlusion. So at the time, we only in the emergency department had one vial of Hyalase, and that's the agent that dissolves this. Now, that is very insufficient to deal with many vascular occlusions that are serious. You can easily go through 4 vials, no problem. And it was 3 in the morning. And it was going to be tricky to get some more. So in my mind, I was thinking, well, how can I deliver what I have, this one vial, as optimally or best as possible? And we'll go back to that. Now, this is actually from a cadaver where they injected like a plastic-like material into the blood vessels and then dissolved away the rest of the tissue. And it just shows you how many blood vessels are in the face. This is one of the reasons why, if you get any needle work done in the face, why it's so easy to bruise. Now, anyone that's doing dermal fillers needs to have a healthy respect and understanding of the vascular anatomy in order to avoid this. And I want to just emphasize that dermal fillers and injectable treatments, they're safe. They're safe. They're well proven to be safe. But like any medical procedure, and I think that sometimes people lose sight of this, is that these are still medical procedures. Any medical procedure carries a certain degree of risk with any intervention you do. And one of the risks is a vascular occlusion, like we're seeing in this patient that I saw a couple of years ago. So in this patient that I just described, if you know your anatomy of the face, you can see that this distribution of what we're seeing here of the necrotic or dead tissue corresponds well with the angular artery. In this picture, it didn't really, this necrotic tissue didn't really extend much more down towards the lips. It was more isolated around the nose. So this was an angular artery occlusion. And now, historically, what one would do to fix this is they would take Hyalase, the dissolving agent, and sort of inject it all over the area where you think there is a problem. That's why you can easily go through 4 vials of the Hyalase. That's the traditional means. But really what you're doing is you're just kind of going, and it's like a carpet bombing approach. You're just going in and you are dissolving anything in the area that possibly can be involved. But I only had 1 vial. So the thought was, can I do this in a more precise way? If I could actually see where the vascular occlusion was. So that brings me to ultrasound. So ultrasound is the standard of care in emergency medicine, at least in Canada and the United States. All emergency physicians are trained in the use of ultrasound. And the reason why it's so handy is because you can easily visualize blood vessels, the heart, bones, lungs, organs like the kidneys. It's great for visualizing these things. You can find, emergency bleeding in the abdomen. When I'm in the emergency department, personally, I find the ultrasound many times more valuable than the other tool I carry on me, which is my stethoscope. But because we can see blood vessels and we with ultrasound in the emergency department, the thought I had was, can I visualize the occlusion in this patient that had the complication from the dermal fillers in the emergency department, which is a little bit outside how we would normally use ultrasound, at least in the emergency department. But there was a problem with that, and I'll outline what the problem was with that by explaining how ultrasound works. And this is a very, very, very gross simplification. But ultrasound, it uses sound energy to make pictures. Technology has been around forever. Like, we're going on 80 years of this technology. Essentially, you're firing sound at a high frequency. You can't hear it at structures underneath the skin. It bounces off those structures. The sound waves comes back and is received by the ultrasound probe. And essentially what that generates is pictures. Things that are black on an ultrasound screen, that's where the ultrasound waves are penetrating through easily. Where structures where the sound bounces off of and goes back appear white. So that's how we can visualize structures under the skin. For instance, this is a fracture of a bone. So this white line here, lots of sound energy is bouncing off that, so we can see a portion of the bone. The nice thing as well is that using some math and some physics I won't get into here, we can actually see fluid moving, and it's called Doppler. So this is a slide where you actually can see blood moving through a blood vessel. This is important in visualizing vascular occlusions anywhere in the body, and the same applies to aesthetics in the face. Now, the reason why the ultrasound technology hasn't been traditionally used to visualize and map out the vasculature of the face is because of this problem, is that there's something called frequency. I'm not going to get into the details. That's not important for today. But as the frequency increases on an ultrasound, two things happen. One is that the sound energy doesn't go as deep. The second thing is as the frequency goes up, we see more detail in the structures under the skin. So the facial anatomy, it's small, right? We're talking about structures that are millimeters in size, whereas, when we're using it on the abdomen, we're talking about large centimeter on the scale of centimeters rather than millimeters often. So the issue is that having an ultrasound that can generate the high enough frequency, we call it ultra high frequency ultrasound, was really relegated to very expensive, and in some cases research-focused devices until the last decade, and particularly portable devices that were cost-effective and could be used at the bedside without having a big cart where you have to wheel it around, was something that really only developed in the last couple of years and opened up the avenue of using this more popularly at the bedside in aesthetic practice. So I took the ultrasound I had available in the emergency department for this particular patient, but it wasn't an ultra high frequency ultrasound probe. So I couldn't see that detail. And I saw something like this on this slide, which is just, doesn't really tell me much of anything other than maybe some swelling is going on there. The other problem was I had no training in using ultrasound in the face at this time, because it really wasn't something, it was certainly not taught with the other ultrasound training I received for emergency medicine. And it really was it's a new thing within aesthetic practice as well. So it wasn't very helpful. And unfortunately, the treatment of that particular patient was delayed because we only had one vial and we needed to collect other vials from around the city essentially to treat this patient. And ultimately what I was left was, as an industry, as a medical field, we need to do better with injectable treatments in terms of making sure it's safe, because we have this technology available. We should apply it for facial aesthetics and injectable treatments. And the other part of me kind of was thinking about, well, when I go in my car and drive to work, I'm not closing my eyes as I'm driving around and guessing where the road is. So why would I guess when I put a needle in under someone's skin in their face where their blood vessels are? And essentially, traditionally, that's what we're doing. You know the anatomy, you have a rough idea where it is, but anyone that does medicine knows that not everyone's anatomy is textbook. There's variations, there's things change. So that led me to learning ultrasound for facial aesthetics and applying it essentially daily in my own practice. So if you're interested in doing facial aesthetic ultrasound, this is what you need. You need a high frequency ultrasound that's a minimum of 15 megahertz. The best is 20 megahertz. When you get over 20 megahertz, the depth is so small, it's less than a centimeter penetration, that it really gets less practical for seeing things in the face. It's nice to have at least 3 centimeters of depth. That will get you everywhere you need to be on the face. There's different types of probes as well. You need something called a linear probe. This is a linear probe, and this is a linear probe. The reason why this is important is you want a linear dispersion of your sound energy, and the linear probe tends to deliver a higher frequency, which is needed as for the reasons I already mentioned. Traditionally, they call this the hockey stick probe, linear probe. This was traditionally what's used in facial aesthetics because the foot plate, which is the part that's in contact with the skin, this flat part, is small, so you can easily navigate around the nose and around the small curves of the face. So that's the ideal. I mentioned in the last couple of years how this technology has really opened up in terms of its accessibility, and that's because of portable devices like this. This is the Clarius L20, which is essentially the size of an iPhone. Traditionally, it was high frequency ultrasound was really relegated to devices like this, which are huge, and this runs well into the 6 figures, whereas this you can grab this for around 10K. So this opens up a lot more accessibility, this Clarius device, and there's a couple other ones out there. So the other part you need is training. So these two physicians are the real pioneers for facial ultrasound in aesthetics. I learned from Dr. 𝘱𝘕. They're both from the Netherlands. And then the third part, and something I can certainly attest to from emergency medicine, is that you need to practice this. With the residents we teach ultrasound in, it takes a couple of weeks before they become comfortable with even the limited exams that they're taught. So you got to get out there and just use it as well, which is a key towards becoming proficient in it. So what do we do with it? So there's really 3 things. One is that we plan treatments to hopefully avoid complications, and that involves in part identifying arteries and vessels on the anatomy. The second part is that we can help diagnose complications when they happen, and then we can treat complications. So the way we can plan treatments is that we can easily see the structures in the face, like the muscles, fat, bone, and the blood vessels that we're trying to avoid with our needle and cannula. This is a ultrasound image that I did of the temple, which if you do fillers, this is one of the higher risk areas. That blinking spot is the superficial temporal artery. And in cases where you put filler in that, you can actually, that's one of the vessels that you can cause blindness because the filler will backflow and can involve the retinal artery. Often what I can say all the time, actually, when I'm doing injections in the temple, I always take a look with ultrasound first. And it's actually somewhat terrifying and also rewarding how many times I put that ultrasound probe exactly where I would have previously injected blind, and I see this blinking dot right where I would put my needle. So very often this changes what I'm going to do for my treatment plan. And so much so that for me, and what I encourage my students as well now to do, is to no filler or no needle enters the face without first taking a look. And that whole gets back to the whole principle of why guess. For me, I view it as essential as cleaning the skin before you use a needle, which is part of what you need to do. This is a diagram I use in my own clinic for actually mapping the face. We map out where the major arteries are, the depth, the location relative to other anatomic structures. So we really have a map of one's face before we start doing any treatments. As an aside, I use it in a couple areas for Botox as well, for our toxins. Basically, I'm looking for anatomical variants. The mentalis is a common one because it slightly changes where I would put my toxin optimally. The second part is diagnosing complications. So I had a patient who was actually a colleague of mine who had some fillers done in another clinic in under eye tear trough, and we had some puffiness afterwards on the under eyes. And they were quite frustrated because they had this dissolved at numerous different places, but they still felt like that puffiness was not getting better. So we used the ultrasound to take a look. And this is actually was a couple days ago. And we can see on this ultrasound image, this is the orbital rim. This is actually the beginning of the globe, so their eyeball. This area here, we see some darkness. This is either edema, so swelling, could be fat, or it could be filler. I suspect, based on the history, that we're likely dealing with filler that is above or beyond the SOOF. So it's now in the orbital fat, which is unfortunately a surgical issue. This is another patient that I had a couple of weeks ago who sent me this picture from home after I did lip fillers. She was quite concerned about this paleness in the lip, and I was somewhat too. And the question here was, is this edema or is this the beginning of a vascular compromise? Sorry, guys. So what I did is I had her come on back and we did ultrasound. And we can see that here is the inferior labial artery. It's lighting up nicely. Very reassured. This is not a vascular compromise. And lo and behold, when I checked in on with her the next day, it was all swelling. That paleness had resolved, and she was quite happy with how things were going. The next thing we can do is we can treat complications. So when we are in the skin, we can actually use the ultrasound probe on top, and we can visualize our needle or cannula right up against filler where we are dissolving. Sorry, guys. Where we're dissolving filler. So that's the situation here on this picture, is that we have a cannula going in and we're dissolving. In here, in this case, we have a vascular compromise. This is not my one of my patients. This is from a paper that was published. We can see that here we have an area where there is some Doppler turned on. We can see that the hyalase is being injected, so that we see a little bit of movement as the fluid's coming off of the needle. But we don't see any other movement of any fluid because there's a vascular compromise. But then we can see moments later, as the hyalase works, the vascular compromise is resolved, and all this color shows up, and that's movement of blood. So we have a restored blood flow. So very important from being able to visualize where exactly the occlusion is and delivering the hyalase in a targeted manner. So my big prediction, based on my experience using this technology and what I've seen in emergency medicine, is that I think in a decade from now, this will be the standard of care. This will be expected from our patients, that we are using this technology or have this technology available to deliver these treatments as safely as possible. So that is the end of my talk. I will just do a plug here, is that I am now teaching facial aesthetics. A course is coming out in the next month. If you'd like to know more information about this, just visit this website up here. You can drop me your email, and I will make sure that you get notified about opportunities to learn this technology and to improve your safety with your injectable treatments. Thanks, guys.
Thank you, Doctor. It is really important, and again, amazing presentation. All the presentation today, I really like it. I do have a question about this technology. It is FDA approval in New York, in United States, too?
Yeah. Yep.
Okay.
So it's the ultrasound machines themselves are what's approved. So you need to make sure you get a device that's approved. The device that I showed, the 𝐾𝐤 device, is FDA approved. There is another one that is that if you're, the 𝐾𝐤, in my opinion, is the best because you're going to get the 20 megahertz. But if you are okay settling with a little bit not as nice device, there's a one by Philips called 𝘱𝘨𝑚𝑓y, which gets you the 15 megahertz. It's also portable. That's a good alternative, also FDA approved. There's other ones out there as well, but we're talking more about the larger, more traditional machines that are not as portable.